Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Friday, September 11th at 5 p.m. The race to distribute COVID-19 vaccines to hundreds of millions of Americans could come down to one question, reported in the Wall Street Journal. Do we have enough deep freezers? And you may say, what? What does that mean? Okay, so some of the shots now in late stages of testing must be stored at temperatures potentially as cold as minus 80 degrees Celsius or minus 112 degrees Fahrenheit. This is similar to conditions for transporting ice cream and steaks to supermarkets. This is not the standard transportation for vaccines that we are used to. Now, hospitals, pharmacies, and physicians' offices are expected to be vaccination sites, but few of them have specialized freezers to accommodate this type of storage. Now, chickenpox vaccine is usually stored at minus 20 degrees and flu vaccine closer to minus 5 degrees, to give you an example of the difference. Okay, so this is way colder and much more impractical for a small doctor's office, for example, to be able to store this. Now, this is prompting a mad dash to put together a cold storage supply chain that can deliver vaccines around the country without letting them become warm and obviously putting them at risk for becoming ineffective. Now, hospitals are considering plans to buy special freezers. Non-traditional healthcare competitors are building facilities to house hundreds of mobile cold storage units known as freezer farms. One drug maker has created its own specialized container to keep vaccines cold enough for at least 10 days uninterrupted. So there's a lot of creativity happening here behind the scenes that we really don't know about. And hopefully all this effort is for I should say not for nothing. Have that worded, that the vaccine actually comes to pass for these people who are spending all this kind of money. Again, not talking about whether I'm pro or against a vaccine, just the whole logistics of getting this actually to come to pass. Vaccine manufacturers are studying whether their shots can be shipped at warmer temperatures without risking quality or safety of the doses of the vaccine. For some, once they've thawed the doses, they must be used within 2 days. Others, they're saying a little bit longer, but that doesn't give you much leeway in terms of usage if you are, again, a small doctor's office who are trying to use this on your patients. Within 2 days means Monday, Tuesday, and then you got to throw it away. All right, so given the breakneck pace of this vaccine development, researchers are lacking storage requirements they would normally learn after clinical trials are completed. They would figure this out once they have a vaccine and then make the logistics happen afterwards. Now they're working on the logistics before these vaccines are even completed. Now, experts are convinced that these ultra-cold storage requirements will stress the supply chains because of the demands required for transportation and storage. Now, with companies claiming vaccines will be ready for mass distribution by November 1st, eek, right? This challenge needs to be addressed yesterday, right? Other medications are shipped at ultra-cold temperatures, often using liquid nitrogen or dry ice, but clearly this is a costly expense. Not to mention the sheer number of doses they are planning nationwide for this vaccine as compared to the smaller numbers needed for medicines that may fall in this category. Now, as many hospitals don't even have adequate storage for vaccines at sub-zero temperatures, access to this vaccine will likely vary dramatically around the country. Okay, so places that do, again, small little towns are not going to be able to accommodate this type of storage. Those areas are going to be requiring people to travel long distances potentially to major hospitals in order to get these vaccines. So not only are they going to be limiting who gets them based on need, they're going to have to be limiting them based on who's going to be able to get them based on location. So this may be the time that if you're pro-vaccine and you're wanting a vaccine, you may want to live near a big city because your private medical physician just may not be carrying them. Your local supermarket, I don't know. I don't know if Publix pharmacy is going to have a deep freezer that's going to be able to store vaccines like this for lengths of time. Questions that will be answered as the coming days and months go by and we figure out more about these vaccines and if they even will come to pass. So on that note, it is Friday. I know it's a somber day. It's September 11th, and for those of you who knew anybody that passed during 9/11, I do. I'm sure plenty of my New York friends do as well. My heart goes out to you. I think about it. I was 6 months pregnant at the time. I remember the day as if it was yesterday. So it's a day we all need to reflect, think back, and maybe just be thankful for everything that we do have, even in 2020. So on that note, I hope you guys have an awesome weekend, and I will see you again on Monday for another Live in 5.